Botulinum toxin, also known as Incobotulinumtoxina Solution, Reconstituted, Recon Soln, is used to treat a variety of conditions. It can be used to treat eye disorders such as crossed eyes and uncontrolled blinking, muscle stiffness/spasms, movement disorders, and to reduce the appearance of wrinkles. It can also help prevent headaches in people who suffer from frequent migraines. In addition, this medication is used to treat overactive bladder in patients who do not respond well to other medications. It can help reduce leaking of urine, the feeling of needing to urinate right away, and frequent trips to the bathroom. It is also used to treat severe underarm sweating and excess saliva. Botulinum toxin works by blocking the release of a chemical called acetylcholine, which relaxes the muscles. It is important to note that this medication is not a cure, and symptoms will gradually return as the effects wear off. The dosage and timing of this medication will be determined by your doctor based on your specific condition and medical history. Before using Incobotulinumtoxina Solution, Reconstituted, Recon Soln, make sure to read the medication guide and, if available, the patient information leaflet provided by your pharmacist. This medication is given by injection by an experienced healthcare professional. It is injected into the affected muscles when treating eye disorders, muscle stiffness/spasms, and wrinkles. When used to prevent migraines, it is injected into the muscles of the head and neck. It is also injected into the skin for the treatment of excessive sweating and into the salivary glands for the treatment of drooling/excess saliva. When treating overactive bladder, it is injected into the bladder. Your dose, the number of injections, the site of injections, and how often you receive the medication will be determined by your condition and your response to therapy. For children, the dose is also based on weight. Most people start to see an effect within a few days to 2 weeks, and the effect usually lasts 3 to 6 months. Most side effects of Incobotulinumtoxina Solution, Reconstituted occur at the injection site, such as redness, bruising, infection, and pain. Other side effects may include dizziness, difficulty swallowing, respiratory infections, pain, nausea, headache, muscle weakness, double vision, drooping or swollen eyelid, eye irritation, dry eyes, tearing, reduced blinking, and increased sensitivity to light. If any of these effects last or get worse, notify your doctor or pharmacist promptly. You may require protective eye drops/ointments, an eye patch, or other treatment. When used to prevent migraines, side effects may include headache, neck pain, and drooping eyelid, while for excessive sweating, non-underarm sweating, respiratory infections, headache, fever, neck or back pain, and anxiety can occur. For overactive bladder, side effects such as urinary tract infections, burning/painful urination, fever, or difficulty urinating may occur. Remember that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including itching/swelling, especially of the face/tongue/throat, rash, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. After receiving the injection, there is a possibility that this medication can spread to other parts of the body, leading to serious, and potentially fatal, side effects. These side effects may occur hours or even weeks after the injection. However, the likelihood of experiencing such serious side effects when using this medication for migraines or skin conditions, such as wrinkles, eye spasm, or excessive sweating, is extremely low. Children undergoing treatment for muscle stiffness or spasms are at the highest risk of experiencing these effects, as well as individuals with certain medical conditions. Refer to the precautions section for more information. It is important to discuss the risks and benefits of this medication with your doctor. If you experience any of the following very serious side effects, seek medical help immediately: chest pain, difficulty breathing, excessive muscle weakness, irregular heartbeat, severe difficulty swallowing or speaking, loss of bladder control. Before using Incobotulinumtoxina Solution, Reconstituted, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It's important to discuss your medical history with your doctor, especially if you have any bleeding problems, eye surgery, heart disease, diabetes, signs of infection near the injection site, or muscle/nerve disorders. This medication may cause muscle weakness, droopy eyelids, or blurred vision, so avoid activities that require alertness or clear vision until you are sure you can do them safely. Also, limit alcoholic beverages while using this medication. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are an older adult using this drug for overactive bladder or a child using it for muscle spasms, be aware that you may be more sensitive to the side effects. If you are pregnant, discuss the risks and benefits of using this medication with your doctor, as it should only be used if clearly needed during pregnancy. Using this medication for the cosmetic treatment of wrinkles is not recommended during pregnancy. It is unknown whether this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Incobotulinumtoxina Solution, Reconstituted. This medication may interact with certain antibiotics, anticoagulants, Alzheimer's disease drugs, myasthenia gravis drugs, and quinidine. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If you or someone else has taken too much Incobotulinumtoxina Solution and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. Canadian residents should call a provincial poison control center. An antitoxin is available, but it needs to be administered before symptoms of overdose appear. These symptoms may include severe muscle weakness, breathing difficulties, and paralysis. If you suspect an overdose, don't wait for symptoms to worsen before seeking help. Before starting this therapy, it is important to understand the potential risks and benefits. Make sure to discuss any questions or concerns with your healthcare professional. Now, let's talk about the uses of Incobotulinumtoxina Solution, Reconstituted, Recon Soln. This medication is used to treat certain muscle conditions, such as cervical dystonia, which causes severe neck muscle contractions, and blepharospasm, which causes uncontrolled blinking. It is also used to improve the appearance of frown lines between the eyebrows. The dosage of Incobotulinumtoxina Solution will be different for each patient, depending on the condition being treated. Your healthcare provider will determine the best dose for you. The timing of when to take this medication will also depend on your specific condition and should be discussed with your healthcare professional. When using Incobotulinumtoxina Solution, Reconstituted, Recon Soln, it is important to follow the instructions provided by your healthcare professional. This medication is commonly used to treat cervical dystonia, which is a condition that causes severe neck muscle contractions. It is also used to treat chronic sialorrhea, or excessive drooling, in adults. The dosage and frequency of this medication will be determined by your doctor based on your specific condition and medical history. Typically, it is injected into the affected muscles and the effects can last for several months. It is important to discuss the optimal timing for receiving this medication with your healthcare provider to ensure the best results. This medication is typically administered in a medical setting, such as a hospital or clinic, and is not intended for home storage or use. It is important to follow the dosage and scheduling recommendations provided by your healthcare provider. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.